Bismillah Rahman Rahim. Assalamu alaikum, my dear ICTV community members. I thank Allah subhanahu wa ta'ala for giving me this opportunity to serve my community. I also want to thank all of you who gave me feedback and encouraged me to be better. Inshallah, I will try my best. I want to clarify, my talks will be based on my scope of practice. As I mentioned before, I'm an associate clinical social worker and a behavioral health therapist. I'm not a religious scholar and will only address mental health topics. Of course, my audience is Muslim and everything I will say will keep in accordance to the Islamic traditions overall. So for example, talking about reciting Quran or performing Salat is a given in our traditions. However, I will leave details about that to Imam Nasr to address in his talks. So today I want to address how to help children of all ages cope with anxiety, especially during the outbreak of coronavirus. According to Substance Abuse Mental Health Services Administration, also known as SAMHSA, it is a federal government agency within the U.S. Department of Health and Human Services that leads public health efforts to advance the behavioral health of the nation. SAMHSA has created tips for parents and caregivers to address anxiety in children of all ages and how to help them cope with the stress, especially during this time. I will include the link to the document here, so please take time to go through it in detail. What you should know when children and youth learn about an infectious disease through the news or hearing others discussing it, they can feel scared, confused, or anxious just as much as adults. Infants and toddlers from the ages of 0 to 2 years old cannot understand that something bad in the world is happening, but they know when their parents are upset. They may start to show the same emotions as their parents, or they may act differently, like crying for no reason or withdrawing from people and not playing with their toys. Children 3 to 5 years old may be able to understand the effects of an outbreak. If they are very upset by news of the outbreak, they may have trouble adjusting to change and loss. They may depend on the adults around them to help them feel better. Children 6 to 10 years old may become aggressive for no clear reason, or they may act younger than their age by asking to be fed or dressed by their parent or caregiver. Youth and adolescents from the ages of 11 to 19 go through a lot of physical and emotional changes, and because of their developmental stage, it may be even harder for them to cope with the anxiety that may be associated with hearing and reading news of an infectious disease. Older teens may deny their reactions to themselves and their caregivers. They may respond with the routine, "I'm okay," or even silence when they are upset. Or they may complain about physical aches or pains because they cannot identify what is really bothering them emotionally. They may also experience some physical symptoms because of anxiety about the outbreak. Some may start arguments at home and resisting any structure or authority. How can parents and caregivers support children in their managing these responses? With the right support from the adults around them, children and youth can manage their stress in response to infectious disease and take steps to keep themselves emotionally and physically healthy. The most important way to help children is to make sure they feel connected, cared for, and loved. Pay attention and become a good listener. Parents and other caregivers can help children express their emotions through conversation, writing, drawing, playing, and singing. Most children want to talk about things that make them anxious and cause them stress, so let them. Accept and validate their feelings and tell them it is okay to feel sad, upset, or stressed. Crying is often a way to relieve stress and grief. Allow them to ask questions. Ask your teens, what do they know about the outbreak? What are they hearing? Try to limit access to the news. And if you can, watch it with them so you can discuss with them, which is much better. Don't let talking about the outbreak take over a family discussion for long periods of time. Model self-care. Be disciplined in your response. Set routines. Eat healthy. Get enough sleep. Exercise. And take deep breaths to handle stress. Children of ages of 0 to 5 years old, give these very young children a lot of emotional and verbal support. Get down to their eye level and speak in a calm, gentle voice, using words they can understand. Tell them that you always care for them and will continue to take care of them so they feel safe. Keep normal routines, such as eating dinner together and having a consistent bedtime. Children of early childhood to adolescence, which is 6 to 19 years old, ask your child or the children in your care what worries them and what might help them cope. Offer comfort with gentle words and just being present with them. Spend more time with the children than usual, even for a short while. If your child is very distressed, excuse him or her from their chores for a day or two. Encourage children to have quiet time or express their feelings through writing or art. This is a great opportunity to read Islamic stories to them, stories about different prophets with some valuable Islamic lessons. In some instances, children may have trouble getting past the response to an outbreak, particularly if a loved one is living in and helping with the response in an area where many people are sick. Consider arranging for the child to talk with a mental health professional to help identify the areas of difficulty. Here are some important numbers. SAMHSA's National Helpline toll-free number is 800-662-HELP, and the Child Welfare Information Gateway toll-free number is 800-4A-CHILD or 800-422-4453. Again, you may also reach me at services@icotv.org for any assistance. Once again, do not react to your children. Take your time to respond to them. Be mindful and don't raise your voice to them. Model calm behavior. Remember, your physical health is connected to your mental and emotional health. So be kind to yourself, to your loved ones, and to anyone who crosses your path. Please also visit us at www.icotv.org and donate to cover the costs of the Islamic Center of Temecula Valley. Jazakumullahu khairan.